Thousands of more positive cases were recorded today, just one day after Wisconsin saw record-breaking highs for confirmed deaths and new cases. State and county health officials said an additional 3,494 cases have been confirmed, bringing the lifetime total in the state to 210,767. 43,000 cases remain active. At least 1,909 have died from coronavirus complications in Wisconsin. 38 more deaths were confirmed today.
Each one of those people who die from the coronavirus have loved ones forced to plan socially distant funerals or memorial services.
It is a heartbreaking task that doctors here worry won't stop anytime soon. Our Gabriela Becerra outside UW Hospital on a night when most of the state is under a high death rate phase. Gabby?
Doctors say it could take many weeks before we see hospitalizations and deaths go down. A funeral director I spoke with says he's never seen a pandemic last as long as this one has. Pete Gunderson sees the worst of COVID-19 every day.
How heart-wrenching can that be?
Helping families cope with losing a loved one to a disease that's showing no signs of getting better in Wisconsin.
Oftentimes it's the first time a family's been able to see their loved one in the weeks that led up to this.
That's become far too common in Wisconsin in the last 4 weeks. The state recorded more than 550 COVID deaths since October 1st. After decades working in funeral homes, Gunderson says the impact COVID is having on his line of work is unlike anything else.
We've been through times of polio, we've been through times of HIV and tuberculosis and a number of others.
UW Health's Dr. Nasia Safdar says COVID-19 works like a wave. First, younger people get sick, then more vulnerable people end up hospitalized, and deaths follow soon after that.
The way it's going now, I think we can expect to see several weeks of this getting worse before we would start to see it getting better.
To get control of those numbers, it'll take effort. Masks, social distancing, and staying home from everyone.
For it to work effectively, it has to be a population-level intervention.
Right now, local funeral homes aren't overwhelmed with COVID-19 deaths.
Initially, everyone was short on PPEs. We're up to snuff on that now.
And they're helping other homes around Wisconsin and the country.
Many are uncomfortable coming into the hospitals and into Dane County or Milwaukee County or wherever the outbreaks happen to be at the moment, and having exposure possibly happen to them.
Gunderson says the fact that COVID-19 can kill someone so quickly makes it even more important for loved ones to have a support system around them as they start the grieving process.
Gabriela Becerra live at UW Hospital. Gabby, thank you.